Okay, so just to start off by saying welcome to this seminar today, which is being hosted as part of the Across PPDA work for NIHR Right Call 6 as part of the Capacity Capability Building work stream. So Across stands for Affordable Cardiac Rehab, and it's an outreach interdisciplinary strategic study research project. The kind of overarching aim of Across is to implement and evaluate a sustainable and scalable, culturally adapted, home-based cardiac rehab for people with heart disease and a mental health condition in Pakistan, India, and Bangladesh. And today for this seminar, I'd like to introduce my colleague, Jamal Udin. Together, we're co-leading the Across Capacity and Capability Building workstream. I'll tell you a little bit more about Jamal very quickly, but I'm sure he can introduce himself and his project probably much better than me. But Jamal was working as a senior chest physiotherapist and lead for cardiac rehab for over 12 years in Dhaka, Bangladesh. He also has a master's in public health in non-communicable diseases. And back in September last year, 2022, he began a PhD at the University of Glasgow. And his PhD project has the overarching aim of developing and evaluating a country-adapted version of home-based cardiac rehab for patients with coronary heart disease in Bangladesh. And as the first stage of his PhD project, he's completed a scoping review of current practice in the adaptation of healthcare interventions for people with long-term conditions. And this is what he's going to talk to us about today. So I'll hand straight over to Jamal for him to talk us through his work. And then we'll reserve about 15-20 minutes at the end for questions and any discussion. So Jamal, if you want to share your screen and take it away, that would be great.
Yes, thank you, Amy, for a nice introduction. I'm happy to share my screen. Can you see?
Yeah, I can see that.
Thank you so much. Yeah. Hi, everybody. Good evening. I am MD Jamaluddin, PhD research student, University of Glasgow, UK. So my today's topic is adaptation of healthcare intervention for people with long-term conditions. It is a scoping review of cultural current practice. My supervisor, chief supervisor is Professor S. Taylor, Chair of Population Health Research, Institute of Health and Oilwing. And so I would like to present the project brief summary. My doctoral research program's overarching goal is to adapt and evaluate the feasibility and acceptability of Bangla version heart manual, which is evidence-based, developed in the UK for people with coronary heart disease living in Bangladesh in order to guide future research and implementation in Bangladeshi settings. So to achieve this goal, this doctoral program consists of 3 linked research studies. One is a scoping review of the international literature of adaptation studies for healthcare interventions. Second one, to co-develop with patients, clinicians, and other key stakeholders an adapted Bangla version of the heart manual. And the last one, to assess the feasibility and acceptability of the adapted Bangla version of the heart manual for people with coronary heart disease in Bangladesh and their families and caregivers. So I would like to discuss about the scoping review methods. This scoping review comprised of 6 stages. First one, the definition of the research questions, identifying relevant studies, study selection, data charting, data collection, synthesis and presentation, and consultation exercise, which is auxiliary. And we use the reporting of this review for Prisma extension version. And the protocol was prepared, pre-registered on the Open Science framework. Here is the link. So now I'd like to discuss about the research questions. So what questions we are trying to find out the answer. First of all, what are the methods and processes used in studies to adapt long-term conditions healthcare interventions? Second, what is the rationale for adaptation and what theories are used in adaptation? Final one, how consistently do adaptation studies conform to methodological guidance for intervention adaptation? So now here we discuss about the criteria to include or exclude in the for this scoping review articles studies. Criteria according to the document type, document focus, and interventions. The document type inclusion any primary peer review journal publications and irrespective of an study design. In exclusion, we exclude incomplete publications, conference abstracts, reviews, guidelines will be excluded. And now document focus, studies describing a process of adaptation, health intervention to a new context, process and or outcome evaluation, but excluded implementation studies and process evaluations without a clear adaptation focus. Now interventions, the complex intervention, basically non-pharmacological, drugs, medical device, and surgical procedures will be excluded. Now comes to the definition of adaptation. So there is a various types of definitions that may include here. The modification made to the content of the intervention and or modifications made to the delivery of the interventions and or modifications made to the context in which interventions are delivered or modifications made in alternative study population or disease group. So we have to include this adaptation articles, and the context is characterized by difference in geographical, epidemiological, socio-cultural, socio-economic, ethical, legal, and or political determinants. Here is the Prisma flow diagram. We have been collected 1,027 articles from this. We use the Ovid, Medline, PsycInfo, SynHall, and In Process, in Data Review, and other non-indexed citations. We have got 1,017 articles, studies, and 10 studies we have got citation searchings and gray literature. So we use here in the Covidence software, and we use this for duplicate removed 7 articles, and screen recorded articles screened about 1,020. Among them, 958 articles have been excluded due to not an adaptation related study is about 611, and not a long-term condition is about 347. So remaining full text articles screened, we screened about 62 articles. And from 62 studies, we excluded 35 because of not an evidence of intervention adaptation is about 17 studies, not an adaptation project, 17 studies, protocol paper was 4, not in long-term conditions 2, and original intervention not clear is 2 studies. Finally, we have got 25 adaptation studies, included 29 publications. So now comes to the result part. Very interesting results here. Here we got that adaptation study publication basis by country wise. We have got majority studies have been published from developed countries, mainly from the United States of America. It's about 62%. Here is the blue color, you can see, and 14% from United Kingdom, and rest of 3% from each different countries of all over the world, from like Africa and China, and also in some portion of Europe. So here is we got the majority studies assessed the early stage of adaptation studies, adaptation process. That we know that adaptation type, there has a 5 adaptation type. There is identification type, development type, feasibility, evaluation, and implementation. So majority study has been completed the adaptation identification part, that is 24 studies, and there have some overlap, that some studies have the identification and development, some studies have identification and feasibility. So we individually that got identification 24 studies, sorry. Developmental part, we used we got 18 studies, feasibility 8, evaluation 4, and implementation studies 6 studies. Out of 25 projects, we have got 68%, that means 70 studies used the qualitative approach, and the remaining, that means 32% studies used the mixed method research. according to the disease or disorder, long-term conditions, we have got this or this proportionate of the articles, like a wide range of long-term conditions are included here. And in the right hand side, the number of studies included, like HIV and AIDS, the 4 articles, cancer, 3 articles, chronic pain, 3 articles, dementia, 3 articles, hypertension, 2 articles, alcohol abuse, 2 articles, and rest of the all disease or disorders like long-term conditions like anxiety during pregnancy, schizophrenia and other psychosis, substance use, arthritis, stroke, type 2 diabetes and obesity, cardiovascular disease and obesity and cancer. So every long-term conditions have one single studies we have got. Now comes to the rationales for the intervention transfer, which is very important slide for our next preparation. So majority of the studies looked at the geographical adaptation from high income to high income countries. That means high income to high income in their own country and the different high income countries, and high income to low and middle income country. And we have got the majority, that means 86% of the original intervention was RCT, randomized controls, which is very evidence based. So if you have a look the chart here, if we come from the below to top, like high income to high income is about 72%, high income to low income, low and middle income country settings that intervention has been transferred is 14%, and the transfer also have one long-term conditions to another long-term conditions in the same country is about 7%, and on the other hand, one socio-economic group to another socio-economic group in the same country is about 7%. So which is very impressive. Now, here is the use of adaptation frameworks or guidance. So we have got more than 80% studies used some form of guidance or theoretical framework to inform their adaptation study, but not consensus. In the right hand side, we got the number of the studies, and the left hand side is the number of adaptation framework or guidance. The different kinds of framework they use in the different articles, which is like the Barrero and Castro's 4-step question sequential model use the 3 articles, assessment, decision, adaptation, and production topical adapt and adapt ITT framework use 3 studies, typology of adaptation 2 studies, consolidated framework for implementation research CFIR is 2 studies, intervention mapping adapted IM adapt guidance used 2 articles, methods for program adaptation through community engagement. And the remaining rest of the articles is single articles used with the different individual framework like Medical Research Council MRC UK framework for development and evaluation of complex intervention, and re-aim research effectiveness adaptation implementation maintenance framework, complementary interrogative research health model, community-based developmental approach to adapt CST to different cultures, formative method for adapting psychotherapy, gold stain framework, framework, and last one, the Tongsiri et al. This article, they used a different theoretical framework. So we have got different kinds of framework they use in different articles. So there is no any specific focused guideline or methods that can be used in adaptation. Now comes to the adaptation checklist based on adapt guidance. So this checklist is very interesting and very important, that this checklist to use assess the quality of reporting methods, intervention, adaptation of included studies. That means this is the checklist that we can use this checklist to find out the quality of reporting of any articles, of adaptation articles. So there have a 5 domain to find out this quality. The first one, the forming and adaptation team. Actually, this portion we are going on the data extraction, and we're using this in one format like the subjective to objective format, that every questions we have got scoring from 0 to 2, like not reported is 0, and partially reported of the or answer this 1, and fully reported of this this answer is 2. So by this way, we will get the answer and find out the quality of reporting. So here is first on the forming and adaptation team. There have some different questions. The 4 questions. First question was this, like example, was there involvement of an appropriate range of stakeholders, including those with expertise and those with knowledge of the new context? And second one, were the team clear on roles, including who will make decisions on adaptations, when and how? Did they work with the developers of the original intervention? If so, do they state how they managed any interest arising from this? And final one, did they consider whether the membership of the adaptation team needed to evolve as the adaptation progressed? Further, do they state how this was done? So we are going to find out this answer, this question's answer into the every articles, and try to give the marking, scoring, and that can be help to find out the quality of reporting of the results. Now discussion and strengthening limitations. So this scoping review seeks to provide an overview of current international practice on the adaptation of health interventions for people with long-term conditions. This review will inform an understanding of the methods and procedures for carrying out intervention adaptation in a low and middle income country settings, which is very, very important to implement some adaptation guidance, adaptation projects. We need to know about this. The strengths of this scoping review includes comprehensive bibliographic database searches, its international scope, and concordance with methodological guidance for the conduct and reporting of scoping reviews. But they have limitations. One is potential limitations includes exclusion of non-English publications and non-peer review journal sources of literature like thesis or book chapters. The conclusions here, we got findings. Studies tends to focus on early phase of adaptation process. Majority of the studies looked at geographical adaptation like high income country to high income country, or high income country to low and middle income countries. Methodological framework used are variable needs for consensus. Assessment of study quality using ADAPT is ongoing, and completion of review expected end of June 2023. Findings of this review can inform future empirical adaptation studies in low and middle income country settings. This research work informed my PhD study too, basically, that developing and evaluating a culturally adapted adaptation framework for heart manual, a home-based rehabilitation program for coronary heart disease patients in Bangladesh. I would like to acknowledge for this study Dr. V.K. Joshi, Glasgow Caledonian University. She is the second reviewer of my scoping review, and her extensive review help and support is really very helpful. And I would like to thank Valerie Well, University of Glasgow, advised on and ran literature searches, and my co-supervisor, Dr. Mithila Farooq, Assistant Professor and Head, Department of Non-Communicable Disease, Bangladesh University of Health Science, Bangladesh. Thank you so much for your comprehension. If anyone wants to discuss with me in this regard, please email me. Thank you so much.
Thank you, Jamal. I'm just going to close my window so I can hear you. Thank you. That was really interesting. Does anyone, I can see Rod's clapping there. Does anyone have any questions for Jamal about the review?
I have a question, Jamal bhai. This is Palash from Bangladesh.
Yeah.
Please.
Actually, what is the difference, basic difference between scoping review and the narrative review?
Narrative review. Actually, scoping review, we use this scoping review to find out the background information of any kind of intervention or any kind of methods that we are going to implement or adapt, or any kind of this study. And narrative, we can just like similar, but narrative has a descriptive voice to describe the scenario as my known.
In scoping review, is there any analysis, secondary analysis like meta-analysis?
No, it's a systematic review have the meta-analysis, but in scoping review, just descriptively, what we got from the articles, we just describe, and we get an overview of the in the field of in this study in this area. But in systematic review, we use the meta-analysis and go for any conclusion that either this good or bad, or any kind of suggestions we can go for. We can provide.
Thanks, Jamal. Yeah, the purpose tends to be around identifying gaps in the literature and the scope of what there is involved in the literature so far. There's no further analysis or quality review of the included studies in the scoping review. Bill, Rod, I can see he's got his hand up.
Thanks very much, Amy. Very nice presentation, Yamal. Thank you. And obviously a study I've been fairly close to. In fact, I've been educated by you, Yamal, doing this study, because I think, as we've realized, the whole area of what we would call implementation science, adaptation methods is a growing field. So I think your review will be a very helpful one for the scientific community. But my question, so we're here today because we're under the Across umbrella. So as somebody involved in the Across study, as you know, we have a work package around adaptation. What would you say are some of the key lessons that you have got from this review for us as part of the Across program? What advice might you give us based on your review? We professors need to hear you.
Thank you so much. It's a very practical questions, I think. Last more than 6 months, I was going through this process, and it's my experience that still adaptation study is a very newly introduced in the world. That we have got most of the articles is later on to 2015, and only 7 articles comes from before 2015. So it indicates that it's a very newly introduced in the world. But when we got the different 29 articles, we find out that they still don't have any standard framework that we can go forward to use this framework, and which is very effective framework for any adaptation or implementation process. So I think this study gives a new idea that maybe this process at this stage the guideline and framework is scarce, but the reporting guidelines may help us to which way we could go forward to adapt any interventions or to implement our next steps. Thank you, Rod.
May I comment, Amy? Would that be okay?
Yeah, absolutely.
Yeah. So I think you're absolutely right, Yamal. And just to share with you that when we wrote the original Across application, it was actually one of Amy's colleagues, Karina Lavelle, led this aspect. And I've just been looking back, and she's proposed using the CFIR. Yeah. So I was very pleased to see that was one of the ones that was widely quoted. But I think it's an interesting question we could take back to the team, Amy, about that there is obviously other frameworks like REAIM, and have we chosen the right framework there? So that I think that's a great question or thing that you've made us think about, Yamal. And then I think the other observation I think I would just genuinely make is that I think, you know, we, as you say, I think a lot of, interestingly, of the studies have initiated from the United States. It seems to be that particularly the NIH, the National Institute of Health, have been using these sorts of approaches. But as you say, they're much newer in a European context and a, you know, north-south global. And then obviously this new framework you've identified in the BMJ, the ADAPT framework, that seems to be very much a go-to paper. Yeah. So again, maybe that's a paper we should be citing in our application. But thank you, Yamal. Really nice work. And as I say, I think it will be very contributory to not just your PhD, but other people's work in this area
Yeah.
going forward. Thank you.
Thank you.
Absolutely. Thanks, Rod. Yeah, I think I had two questions and they were very similar to yours, so I'm glad you asked those. I'm happy. Jamal, I was also going to ask you about the ADAPT framework, because the CFIR was obviously what we've proposed in Across, and that's the framework that I've had experience with previously. And I wondered if you thought there were any benefits to using ADAPT. And obviously I noticed you'd use the ADAPT checklist as well, which seemed really, really useful.
Yes, yes, the ADAPT checklist and ADAPT guidance, ADAPT framework. ADAPT framework is actually help us to specifically focused on the like every individual stakeholders, what the rules, and the checklist, every domain. They try to touch the every domain of during the process of adaptation in articles. So there's help us to don't mistake to do any further work, that if we go use the adapt framework, and also may consider always behind our mind that the checklist, we have to think about the checklist and using the guideline. So that can be helpful to improve the quality of the study and project here.
Okay. Brilliant, thank you. And I can see someone else has their hand up, Shrikant. You got a question for Jamal?
Yeah. First of all, Mr. Jamal, it was a really good presentation. This is a very new topic for me too. Well, I am from Manipal, College of Health Professions from India. I'm also pursuing a PhD in cardiac rehabilitation itself. So this is a very interesting topic, and adaptation is something new for me. My question for is that the adapt checklist, as you said, you had in your results, you had found there were many frameworks, and as you said, we still don't have a firm or strong point that this one framework is better than the other. So is there any way of assessing those frameworks? Like there is the adapt checklist for assessing adaptation. So is there anything to assess the frameworks, or is it possible that the adapt checklist, by assessing the adaptation articles or the studies with the adapt checklist, there is scope to assess the frameworks themselves, or to form such a assessment method?
Yes, thank you so much for your nice questions. Yeah, I think the adapt checklist, this checklist actually for in general, all of the framework you may assess by this checklist. Different kinds of framework use, like any cultural adaptation, or any just intervention adaptation, or just any kind of different kinds of mode of adaptation. But by using this checklist, adapt checklist, this checklist you may use in the different stage of the adaptation, like adaptation in identification, adaptation in development, adaptation in evaluation, adaptation in feasibility. So every stages you may use this adaptation of checklist, which help you to improve your study, that you may follow this checklist to using your studies. So I think if whatever you use in the guideline in framework, which framework, but if you consider this checklist, that might help to use properly this checklist, this framework. But still there has an ambiguous that you don't have any specific framework that might be very helpful or very effective way to adapt our studies. So adapt an intervention. So that's why this scoping review give an idea that you may use the checklist by this way, we using the scoring format to quality outcome. So that might be help to use any framework for intervention adaptation. Thank you.
Thank you.
Thank you very much. Any other questions? I just have one more thing to ask Jamal, if that's okay. So
Yeah.
I think I'm right in saying that your scoping review is looking at adaptations from one single condition to another single condition, or one country setting, say, to another country setting. Were there any of the studies that included multimorbidity, mental, physical multimorbidity?
Yes, if you go through there maybe 4 or 5 articles, they use the different conditions in this for any single studies, like pregnancy with depression, and also cancer with mental health. So so there have evidence, and hopefully it's easy that when the combat the two different interventions, two different disease or disorders addressed in a single intervention, which helps to understand, who helps to apply for the patients. Thank you.
Okay, thank you. That'd be really interesting to have a look at, because I think that's obviously our aim in Across, isn't it, to look at the multimorbidity papers. It might be useful to look at those as a subset. Yeah, brilliant. Okay, thank you. Any further questions? Brilliant. Okay, well, I'd just like to finish off, Jamal, by saying thank you so much for interesting presentation, and thanks to everyone for their questions. We look forward to keeping you updated about the progress with Across, as well as things hopefully progress over the next few months. And we will hopefully have some more seminars in the future, so we'll be able to let everyone know. I hope it's been useful today. And obviously we'll also look forward to seeing Jamal's paper when it comes out in the future, because I'm sure it'll be relevant to a lot of our work. So thank you so much.
Thank you so much for nice and patient sharing. Thank you.
Thanks, everyone.
Thanks, Rod.
Bye-bye.
Bye now.
Bye.